Today, the director of the CDC will join doctors working with Johnson & Johnson, Pfizer, and Moderna and the FDA to talk about the impact of COVID-19 on kids. During the virtual meeting, the group of experts will also discuss the role of pediatric vaccines in the pandemic, as well as some of the uncertainties surrounding them. Internal medicine specialist and immunologist Dr. Neeta Ogden is with us now to talk more about this. Thank you so much for joining us this morning. When it comes to preventing the spread of the virus in schools, is vaccinating children the most effective approach, or could just testing them for COVID be equally as effective? And I think about my own kid during this past school year. You know, obviously vaccines aren't available, and so that's what it was. It was, you know, self-reporting any symptoms for you and your household before your child went to school, and then if any kid tested positive, then, you know, that kid was pulled out, and probably also their cohort, which means it was a little disruptive, but only to sort of a small group of kids. So could vaccines or testing be equally impactful?
Good morning, Anne-Marie. And I think you're raising really good points that this symposium is going to definitely address. You know, we have to really think, I think all of us have these anecdotal stories about how it worked in our schools, but we really have to think of the wider landscape of the United States. And in fact, many students did not go back to school. This symposium is really going to look at those widespread, unique effects of the COVID-19 pandemic on children, on emotional well-being, social development, mental health, and how that really affected even, you know, ethnic minorities, children with disabilities more than any, or lower income areas more than any other group of students. But I think you really raise a good point. I think they want to sort of look at the risk-benefit ratio of vaccines and what could there be a global strategy that we use in certain age groups for school children? And that speaks to another conversation about global vaccine scarcity. Are we really going to put all this effort into vaccinating certain age groups, whether it be infants or, you know, the age of just 5 to 12, when the rest of the world, where the COVID epidemic continues to rage and there aren't good vaccines, they don't get those highly efficacious vaccines that we have here in the United States. So I think this is a really ongoing discussion about what, you know, should be done with this age group. And we have those trials underway, 2 trials underway for 5 to 12 years old, but they may, you know, face some regulatory challenges, safety above everything else in this country. We're really looking at what different doses might be for different age groups. So I think this is such an evolving process, and we really can't say what strategy is going to work best at this point.
I want to get back to the vaccine conversation, but you said something that I think is really good, and I want to underline. It was a really good reminder to me that the impact of this pandemic is not strictly limited to how many children got sick. It's all the other effects. And in fact, you know, kids were not getting sick, but they were still feeling the impact, and particularly kids that are more vulnerable, kids that would have really benefited from additional educational intervention, kids who need special help. They really, really had a rough year, and I think that's a great reminder, not to mention, you know, the social skills and all that other stuff that you normally get in school. So in regards to the vaccine, Dr. Fauci said that he's cautiously optimistic that kids under 12 will be able to get the COVID vaccine by Thanksgiving. Does that sound realistic to you?
Yeah, I do think it is realistic, you know, and I think that typical of this administration will probably see it earlier than that, you know, in the fall, maybe right around when school starts. So, like I said, there are 2 trials underway, and we know that, you know, there are 2 sort of arms here, that the more people, including children, that are vaccinated, the less pockets of spread and variant development that we'll see. So there is an urgency to vaccinate everyone in this country. And I think they're weighing, like I said before, you know, a lot of the safety parameters, what will be the right dose, this issue of myocarditis that was addressed last week, I believe. And I think these things may slow it down to around Thanksgiving, but I'm predicting it'll come out, the approval will happen even earlier.
So both Moderna and Pfizer say that their vaccine offers significant protection against this Delta variant of COVID-19. Still, there are a lot of concerns about this variant. The WHO said everyone should keep wearing their masks, inside, outside, vaccinated, unvaccinated. Also, though, we're seeing some areas of the country, like in California, where they're saying, yeah, we should bring back these mask mandates. What's your take on this? If you're fully vaccinated, should you wear a mask?
I really think that it's so important to look at this as a transition time as we're coming out of the pandemic. In some areas, this country is only 50% vaccinated. So it really depends on risk. What they're recommending is that you look at your community spread. Are there high, transmission rates? What level of people are vaccinated? If you're going to be around immunocompromised people, these are all things to take into consideration when you're thinking about masking indoors. So if you're living in a state where there hasn't been much vaccination, and that definitely exists, and there's high community spread, high hospitalizations, I would definitely wear a mask indoors. But I also think it's such a personal decision. Even if you live, in states where there have been great vaccination rates, you may have unvaccinated children at home. You may have immunocompromised family members. Maybe you work in a high-risk setting. These are personal decisions that I think we all have to make. And some people may opt to continue to wear masks even after the pandemic is well over. But I do think an important point here, when the WHO is saying one thing and CDC is another, this is about community transmission and breaking the transmission chain. The message here is not that if you were vaccinated, you're at high risk for getting the Delta variant. I mean, we all know that vaccines are not 100% effective. There is a chance of asymptomatic and mild infection, and that's really what they want to stop, that those people might, pass it along to someone who's unvaccinated or who's immunocompromised, and that chain of spread that could lead to hospitalizations in those more vulnerable populations. So I guess the message really is here to go and get vaccinated, because that's really going to, help curtail these kinds of surges. As the Delta variant spreads, inevitably more people, even people who are vaccinated, could end up with infections, even if they're mild, and that leads to more community spread.
Very true. Dr. Neeta Ogden, thank you very much.
Thanks for having me.